Our next speaker is Professor Ruth Prassl, who is Associate Professor at the Institute of Biophysics at the Medical University of Graz, Austria.
Thank you very much.
Dr. Prassl is going to talk about mucoadhesive thiochitosan-coated liposomes.
Yes, for the oral administration of drugs. So the oral administration route is one of the most convenient routes for patients. So the patient's compliance and acceptance for oral drug uptake is extremely high. But there are many shortcomings. One of the shortcomings is that some the bioavailability of sensitive drugs like peptides and proteins is very low, so the proteins often become degraded by enzymes. And the other shortcoming is that there is an insufficient uptake of the drugs in the gastrointestinal tract. So our strategy to overcome this problem is to take liposomes as delivery systems for these peptide or protein drugs and to couple to the surface of the liposomes a sialylated polymer termed thiomers. So thiomers are thiolated polymers. These thiomers have been developed by the group of Bernkopf-Schnürch in Austria and also from his company Thiomatrix, and it has already been shown that such thiomers show a prolonged residence time in the mucosal membrane, that they have an improved permeation enhancing effect, and that they are also working as efflux pump inhibitors. For our studies, we have taken chitosan as polymer, and we have modified this chitosan. We had two different molecular weights, so 77 and 150 kilodalton with thioglycolic acid, and you end up with a product which has 3 SH groups. So these are the reactive groups. Such thiomers or thiochitosans are not very stable, so it may happen that they start to aggregate or to become oxidized at pH values above 6.5, and their reactivity is also dependent on the pH. So to overcome these shortcomings, we have modified our thiochitosan by coupling a protecting group. So this was done with thionicotinamide, which makes then this S-protected chitosan TGA, which is much more stable and even more reactive. So to see whether the coupling reaction works, first of all, you have to couple it to the liposomes. So our liposomes are composed of standard phosphatidylcholine, so DPPC, and in addition you need a malamide functionalized lipid where you can covalently couple the TGA chitosan or the S-protected chitosan. So you have this DPPC liposome. The size of these liposomes is adjusted to about 200 nanometer by size extrusion, and then you do the coupling reaction. To see whether the coupling reaction was successful, you can determine the 3 SH groups by this Ellman assay. So if you have control liposomes are DPPC liposomes without the malamide functionalized lipid. So you can determine the 3 SH groups of the chitosan. And if the coupling reaction was successful, you can see a decrease in the 3 SH groups due to the covalent coupling of the chitosan to the surface of the liposomes. If you do the biophysical characterization, you can see that the control liposomes just incubated with the thiochitosan have the same size, 200 nanometer, independent of the added polymer. If the coupling reaction was successful, the size of the liposomes increases. So this was standard dynamic light scattering measurements. At the same time, if you look to the zeta potential of your liposomes, so which is characteristic for the surface charge, you can see the Malay-milled functionalized liposome have a negative zeta potential, and upon coupling, the zeta potential is increasing to about 20 millivolt. If you look more closely to the liposomes, here we have done frizz fracture transmission electron microscopy. So these are the uncoated liposomes, and these are the coated liposomes. You can see that the size of the liposomes is not just increasing, but that the liposomes, the single liposomes, are cross-linked with this polymers. So this is a cross-linking of single liposomes which cause us this increase in size seen with dynamic light scattering. So next we have looked to the stability and release of our liposomes, and for this we have used a fluorophore quencher system. These aren't the big system, so if the fluorophore and the quencher are incorporated in the liposomes, the fluorescence intensity is low. When the quencher and the fluorophore are released, the fluorescence intensity increases, and from this intensity increase you can calculate the release rate. So when we incubate our liposomes with PBS, you can see there is no release in the time of 72 hours. If we incubate our liposomes with simulated body fluids, here you can see that it's simulated gastric fluid. This is at pH 1.2. There is no release from the fluorophore from the liposomes in the time from 24 hours. In contrast, if we incubate our liposomes with simulated intestinal fluid at a pH of 6.8, we can see a time-dependent release of the fluorophore. So next we looked if our liposomes are really mucoadhesive. For this experiment, we have taken freshly excised porcine small intestine, and we have used some modified liquid film technique where we have rinsed this small intestine with our liposomes, and then we have washed it. The liposomes have been labeled with rhodamine to make them visible. And what we have seen in the histological sections of the porcine small intestine, this is the control. And so you cannot see any particles. In P you can see uncoated liposomes. Here you can see some unspecific attachment of uncoated liposomes. And here you can see the TGA-coated liposomes which adhere to the mucosa layer. So we could show with this that our liposomes attach to the mucosa. The next question was if the liposomes are able to penetrate the mucus. For this experiment, we have taken porcine intestinal mucus. We have carefully overlaid the mucus with our particles. Then we have incubated the particles with the mucus, and then it was frozen, cut, and the tissues were observed with fluorescence microscopy. To get rid of the autofluorescence of the mucus, we have measured the mucus at 2 different wavelengths. So here you can see the control. In between the white borders, there is the mucus. And if we have the fluorescence in green and in red for the control, and you overlay this, you can see everything is yellow. So this is the autofluorescence. If you put here the uncoated liposomes, you can see that there is some penetration unspecific of the uncoated liposomes. In contrast, if we take the TGA liposomes, you can see much more particles penetrating the mucus, and this was even more pronounced if we have taken the S-protected liposomes. So we could show that our liposomes, which are coated with the thiolated chitosan, show mucopenetration. The next was we wanted to see if our liposomes are permeation enhancers. For this, we have taken this Assing chamber device, and we have taken rat small intestine, and our drug solution was in this time the fitzdextran, which was put in the donor compartment. And if you look to the results of the cumulative transport of FD4 across this rat tissue, here you have the FD4 fitzdextran control. This is unspecific uncoated liposomes, and if you go up to, you can see these are the coated liposomes, and this is the S-protected liposomes. So the transport of FD4 across the tissue was most pronounced for the S-protected chitosan. At the same time, we could have looked to the transepithelial electric resistance. So you have here the tear value. This is of fitzdextran, and here you can see that the decrease in the tear was much more pronounced if you take this thiochitosan coated liposomes. So we could also show with this experiment that our liposomes work as permeation enhancer. So the next question was whether these liposomes are also efflux pump inhibitors. So this is again the permeation enhancement, where we got this 1.4 decrease in the tear value for the S-protected liposomes, and these liposomes we have taken for the experiments with the for the efflux pump inhibition. So efflux pump inhibition, our substrate was rhodamine. Rhodamine is known as B-glycoprotein substrate. So here you can see the absorptive value, which was about 1.8, but the secretory value was extremely high. This means that the drug was pumped back again. When you take verapamil, this is our positive control, and you look to the transport from the basolateral to the apical compartment, you can see that this is significantly decreased. The value is similar, decreased if we take our chitosan-coated liposomes, and if you combine both verapamil and our liposomes, you can even get better results. So you can see that the secretory value is strongly decreasing. This means that our liposomes are also work as efflux pump inhibitor. What we did next was we looked if it also works in vivo. For this in vivo stuff, we have taken rats, and the drug was calcitonin. The calcitonin was loaded into the liposomes, and different samples were administered to the rats orally. And calcitonin is known to reduce the blood calcium level. So we have taken the blood after certain time periods and have determined the blood calcium level. So these are the results of the in vivo study. Up here you can see this is the calcitonin solution. Administered orally, you have only a reduction in the blood calcium level of about 7%. So if you take our liposomes, and here especially if we take these as protected liposomes, we can see that we have a reduction in the concentration of the blood calcium to 65%. And if you look to the area above the curve, you can see that we have an 8.2 factor enhancement ratio compared to the oral solution of free calcitonin. So with this experiment, we could also show that our liposomes are working in vivo, and that they significantly can increase the bioavailability of drugs. So to summarize, the thiomer-coated liposomes form covalent bonds with the mucous glycoprotein, leading to a prolonged residence time of the delivery system in the small intestine. The encapsulated compounds are released within the small intestine, triggered by the intestinal fluid by opening tight junctions, and efflux pumps inhibiting the thiomer-coating liposomes promote the permeation of the released drug through the gut wall into the bloodstream, thus enhancing their oral bioavailability. And in vivo studies confirmed the potential of our liposomes, especially for the liposomes which have been coated with the S-protected thiomers. So I would like to acknowledge the work of Kerstin Gradauer. It was the work of her PhD studies, and she's now at the Sichuan University in Japan from the Novo Nordisk postdoc program, continuing a similar work. Then I would like to thank Andreas Bernkopf-Schnür from Thiomatrix and his group in Innsbruck for the in vivo studies in the mouse, and then our colleagues from Graz helping with fluorescence microscopy and with electron microscopy. And thank you for your attention.
Thank you. Thank you. Are there any questions? Yeah, I have a question. Kerstin Gradauer is sponsored by Novo Nordisk. Does it mean that you want to apply that to insulin?
For sure, she's working on insulin, but she's now currently working on mice cells.
I mean the oral administration of...
The oral administration, for sure, but as told, she's working currently on micellar systems, not on the thiochitosan-coated liposomes, because I think the thiomers are rather at the Thiomatrix in Austria.
I mean, there's always the issue of dosage, right? I mean, if you have... Anyway, are there any other questions?
Thank you for your talk. The efflux inhibition, how is that working from the particle? And what happens when the particle has carried the drug into the cell? Is the drug not able to still be pumped out of the cell?
So this was the reason of this bidirectional study, so that on the one hand you measure the transfer from the apical to the basolateral, and on the other side from the basolateral to the apical. And if you inhibit the P-glycoprotein pump, so you can see that the efflux is reduced. So you have to take both directions to see if the enhanced uptake and the secretion is working.
So the particle is binding onto the PGP receptor, and
yes.
Then, but when the particle enters
and
the cell,
normally
does the drug...
The cascade of the thiochitosan is that the tight junctions are normally then opened above the cascade, where you have this reduction of glutathione.
Okay. Yes, you have a question?
I have a question. What's the total charge of liposomes? Total charge?
The total charge depends on the polymer coated and on the free SH groups. So we have just determined the zeta potential, which was increased to about 20 millivolt. So we haven't measured the absolute amount of charges on the surface, and they are strongly depending on the pH you are working.
Because you have a slice, when you put the varapamine in liposomes, then the inhibition of the P-glycoprotein enhanced. Because I did the measurement with negative charge the lipids, it doesn't work. Only with the positive charge the lipids.
So the lipids are not in contact. So you have a disulfide bond from the free SH groups of the polymer, which bind to the glycoproteins. So you have this binding of the polymer, not of the lipid.
So the polymer,
The polymer
at the
binds.
surface of the liposome.
The polymers on the surface of the liposome and the free SH groups of the polymer are binding, so forming disulfide bridges, so disulfide bonds.
Okay, that's interesting. Thank you.
Thank you.
Any more questions? Are there any questions to the other speakers still that you have not been able to ask before? So we have a few minutes time. Are there any more topics you would like to discuss? Well, if not, I want to thank the speakers, and we're able to give you back 10 minutes to have an extended lunch. Thank you very much.